To say that Los Angeles is the wild, wild west, at least when it comes to Medicare Advantage plans, is a bit of an understatement. The second largest city in the country, an aging population, and a level of diversity that rivals the bars on Tatooine, Los Angeles has some amazing Medicare Advantage plans in 2025. Today, I'm going to go over my 5 list of Los Angeles Medicare Advantage plans in 2025. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare Advantage option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Oh, don't forget to like and subscribe too. Los Angeles, having so many Medicare plans really can be a blessing of too much. They have plans that do this, they have plans that do that. They try to find every single angle to set themselves apart and be kind of shiny in a very crowded field. But that can make it really hard for someone just trying to figure out which plan might fit their needs in the short amount of time that is the AEP period. But just remember, whichever plan somebody is looking at, it is the doctor's networks, the medications, and the benefits that are most important to get down first. Then you can figure out whether you need the $2,000 or the $1,700 dental allowances. First up today, and these are not in any particular order, but the first up is going to be ideal for a person who is maybe new to Medicare or actually doesn't have a lot of healthcare needs, meaning they don't use services with multiple and disparate doctors or networks. They aren't taking many medications and they are flexible on their hospital networks. And if they are, then the Alignment Smart Savings Plan may be something to look into. I say this because the benefits are decent. It has a $0 copay for the doctors and specialist visit. It's a middling out-of-pocket maximum at $2,899 for the year. And it comes with a decent comprehensive dental benefit standard with the plan with no additional monthly premium. And that is all good and well, but one thing that it also has going for it is the biggest Part B premium give back I have come across this year, 2025, at $150 a month. So that is a sizable chunk of change back into a beneficiary's pocket and could be a good choice, again, if they're not sacrificing those other 3 more important things I mentioned earlier to get it. Next up is a plan that I find super interesting. And it's a plan that has been around for not that long. It's relatively new. And I find it interesting because, well, I love my wife, I love my mom, I love my grandmother, and they all have something in common. Can you guess? They are the fairer of the sexes. They are women. And SCAN this year has a plan called the SCAN Inspired by Women for Women. So yeah, it's a Medicare Advantage plan that really is going to be designed with women in mind. Isn't that great? One of the best things to mention about this plan to start off, and I don't think this is women inspired, but is the out-of-pocket maximum, which is at $299 for the year, which I think is probably my new lowest MOOP out-of-pocket that I think I have seen this year. It has $0 copays for primary and specialist doctor's visits and comes with a standard comprehensive dental that can be upgraded to a PPO version for a little bit more monthly. Now, one of the only downsides of this plan is going to be the fact that there is a monthly premium of $25 a month, which has to be paid on top of those Medicare Part B premium. Also, I know it is inspired by women and for women, but also I don't think it's a requirement, by the way, to be a woman. Anyone can enroll in it, and with a MOOP that is that low, I mean, I think it'd be good for anybody. Moving on to the next plan, there is one that is going to be more for someone who doesn't like to be tied down or bogged down with the HMO structure that is oh so popular in Medicare Advantage world right now. But they are looking for something a little bit more freeing, a little more PPO-ish, which is the Aetna Medicare Core PPO plan. Now, first things first, understand that PPO plans in Medicare, and really under 65 plans, do allow for folks to see a much wider group of doctors and hospitals, both in and out of network. But for out of network, the cost can be considerably higher and result in a much larger yearly spend on healthcare. It's sort of a you gotta pay to play type situation, but it does allow someone to see doctors in varying networks and not have to worry about getting pre-approvals or having as much bureaucracy all mixed in with their healthcare. That being said, the Aetna PPO plan doesn't have a monthly premium, which is just shy of unusual for PPO Medicare Advantage plans. Usually, most of them do have a monthly premium. It doesn't have a deductible, and the out-of-pocket maximum for the year is at $4,499. $8,500 for in-network, which is sort of high, and $8,900 for out-of-network, which is also sort of high for PPOs, but just sort of high in reality as well. So it's a lot, but in perspective of the other PPO plans, it's not that bad. There's also a Part D prescription drug deductible of $590 a year. And where you can see the cost really start to kick in for the PPO is in those two-tier doctor network copays, because it's $0 to go see a specialist or a primary care physician if they are in network, but using the PPO side of things and going to an out-of-network doctor is $25 for a copay for PCP and $65 for a specialist. So yeah, it is more costly when using out-of-network services, but that is sort of kind of the reason that someone would want to get a PPO specifically, is to use those out-of-network services, and the cost is just going to be a little bit more for that. For the number 4 plan on this list, and if there is one thing that is true about Los Angeles, it is that it is an expensive city. I mean, if you go to the grocery store like Erewhon, they have $100 smoothies. I mean, that's sort of ridiculous. But it also means that folks who are low income, they really struggle to keep up here. And double that for seniors who are on fixed income. So this next plan is really designed to specifically help folks who are Medi, or that is they have both eligibility for Medicare and Medi-Cal. And these dual eligible plans help them to make the most of both of those benefits. And one of the decent plans we got asked for most here in Los Angeles is from Blue Shield. In fact, it is the Blue Shield Total Duals plan. Being a Medi plan, it doesn't really have any cost for services, and those are typically optimized to make the most of the Medi-Cal and Medicare combined coverages. But the two things that really make the difference on this types of plans are, one, the doctor's network, and with the Blue Shield Total Dual, beneficiaries can get the full accompaniment of private doctors that are available on the Blue Shield network. And this can be different than what is available on the Medi-Cal networks. And there are extra benefits like hearing aid allowances at $1,500 a year, and dental benefits including restorative and emergency benefits, and a reasonable but not stellar over-the-counter benefit of $70 a month that can be used at the pharmacy. Last up today, and sort of related, is another type of special needs plans that's available on Medicare, a Medicare Advantage plan that is, instead of being focused on folks who are eligible for Medi, so Medicare and Medi-Cal, these plans focus on helping somebody who has specific healthcare chronic needs. So this could be things like heart disease, it could be diabetes, or even end-stage renal disease, or COP. But for our clients, given the community that we work in, one of the biggest chronic conditions that we see is diabetes, and then heart disease, but really a lot of diabetes. And that is why for these C-SNP plans on the list, the one that got chosen is the one that is most often enrolled in our offices in Los Angeles, which is the Alignment Heart and Diabetes Care. And I guess they went with a very direct approach on the name. So the plan gets picked a lot because of, one, the medications that are most common for diabetes care are present on the formulary in large numbers, which always makes it a lot easier. Also, there is a reasonably low out-of-pocket maximum of $990 for the year. There is no deductible, nor is there a monthly premium, and there are other extra benefits like over-the-counter benefits, which are pretty low at $25. But still, nice to have them available. But also access to podiatry, acupuncture, and other non-Medicare covered services that do help provide a little extra relief for those folks living with diabetes and heart disease are available. So overall, Medicare health plans in Los Angeles really do offer a little something for everybody, as you can see from the pretty wide variety of plans we talked about today. But of course, as much as I like these plans, or as often as our clients get these plans, what it is going to come down to is, first, if the doctor's networks and the prescriptions are right for somebody, and the rest kind of all sorts of gets figured out. Now, in fact, if you or somebody you know is trying to figure out these questions or has other Medicare questions, either this AEP or really all year round, please feel free to reach out to us at the information down below, and we are going to be happy to help them over the phone or in person at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe so you can get updates when our newest great Medicare content comes out every single week that also gets doubled up during AEP. So for Michael's Medicare, I am Michael, hoping that you have a great rest of your day, and goodbye.